name's Mariah. I'm with the State of Alaska Medicaid. I am the Medicaid Transportation Manager, and I've been involved with Medicaid for 14 years.
All right, thank you. And Mariah's with us so that at the end of the session, when we're getting into questions, you will be getting the answer right straight from the state. All right, so what we're going through today is transportation and accommodations, travel requests and arrangements, and this is a version of this training. We do this training on a regular basis for providers through WebEx and around the state. The version that we normally would present has a little bit more information about hotels and arranging air travel and things like that, but we have not included much of that in this version, because mostly what you would be doing is in-town travel and arranging ground travel and that sort of thing. So that's really more what this focuses on. If you are curious about the other information, or you would like to access the information about the fuller training, that's available on our website, medicaidalaska.com. If you're on the training page, you can reach it by clicking the Training Documents button. All right, and just to repeat again what Kara mentioned earlier, this training involves medical transportation for medical appointments. This is not waiver transportation, which would be, of course, the travel that's included in your patient's or your client's plan of care on a regular basis. This is more the one at a time sort of situation. All right, so that said, what we're going to talk about in this session is covered services for travel for Alaska Medicaid members. We are going to talk about service authorizations, so how they're obtained and when you need them and so forth. We will talk about provider responsibilities for arranging travel, member responsibilities, and then some additional resources that are there to help you and your clients as well with getting services arranged and knowing how things work. All right, so starting with covered services. For Alaska Medicaid to cover travel for members, they need to be traveling for services that are medically necessary. The services that the person is traveling to receive need to be directly covered by Alaska Medicaid and provided by an Alaska Medicaid enrolled provider. So essentially that works out to the services have to be kind of encased in Medicare, referred and received and provided by a Medicaid provider, and they need to travel with a Medicaid enrolled transportation provider as well. Coverage is limited to the nearest facility or provider that is capable of meeting the patient's medical needs, or in the case of Alaska Natives, they may go to the nearest Indian Health Service facility. For non-emergent travel, service authorizations need to be in place prior to the travel, and all the documentation and other things need to be in place. There is no mechanism for a person traveling and getting their travel compensated after the fact. These things do need to happen before the non-emergent travel happens. In general, you as care coordinators would not be arranging lodging for your folks, but if they are traveling over a weekend, and this applies to travel as well, in general, transportation, accommodation, those things are only going to be authorized on the weekend for medical necessity purposes. If that's when the provider's office hours are for some reason, then that can happen. Otherwise, no. And in some cases, members may have escorts authorized to be with them, not in all, and that again is medical necessity. And we'll talk about escorts and when they're authorized a little bit later. So the services that can be covered under the travel program include air travel, travel by ferry or railroad. Those are the more distant things that you would very likely not be involved with, but it's good for you to know what's available for your members. For ground transportation, that can include taxis, bus rides, rides in wheelchair vans, and then other things that are covered, which again would probably not impinge on your services, would be hotel or motel with or without meals, prematernal homes, escort travel, and then emergency transportation is also covered. All right, so one thing that comes up pretty often is who can and who cannot request travel. So the people who can request travel are medical providers and their staff, and that's long established. That's been around for a while. Care coordinators may request travel. If you have patients that there are clients that need to travel and for whatever reason their medical providers either cannot or don't do that, then care coordinators may step in and arrange travel as well. And also social workers that are connected with medical facilities that are providing services to the member. So that's who may request travel. Who may not request travel is patients, parents or guardians of patients, or transportation or accommodation service providers. So taxis, wheelchair vans, those folks may not request travel service authorizations. And the reason for that is they are not aware of a person's medical necessity. All right, for transportation within the same community, that is going to be authorized under limited circumstances. Lodging and meals are not authorized within a member's community of residence. Coverage for travel is authorized when the member does not have access to public transportation and the member does not have any other mode of transportation available to them, such as local family members. So do be prepared to be asked that if you're calling in for service authorizations for your folks. The travel authorization team does need to have that information. Members who are children under 21 or who are pregnant can also arrange travel through the EPSTAT Well Child Transportation Program. And a little bit later on, after we go through the formal presentation, I will show you where to find the resources on that program. But that is a sort of an alternate travel program that works a little bit differently than Medicaid travel. So we'll look at that a bit later. The possible available means of non-emergent ground transportation include non-emergent ambulance, if the person needs that level of medical support, wheelchair van, which a lot of your clients very likely are traveling through, taxi or shuttle service, and bus. Non-emergent ground ambulance does not need to be prior authorized. Those services are billed after the fact, after the rides are provided, and they just use medical justification. So that is not a thing that you would be authorizing. But everything else, wheelchair van, taxi or shuttle or bus, those things all need to be authorized in advance and need to be documented on a travel voucher that the member or their escort gives to the transportation provider. Medical appointments need to be set during the provider's normal business hours. Ground transportation is covered on weekends when it's authorized and necessary to accommodate a medical provider's schedule. And we already talked about that a little bit, but by and large, weekend travel is not going to be authorized unless it is that kind of situation where you need to work with someone's schedule. The type of transportation that can and will be authorized is based on the patient's need and the availability within their community. Ground transportation is only covered for medical purposes, not for personal travel. And again, I'm going to remind you, this is not the waiver travel that a person would have as part of their plan of care. This is case by case, one at a time travel for medical appointments. All right, there is an Arranging Member Travel Manual, which is posted out on MedicaidAlaska.com. If you happen to be accessing this presentation electronically, if you've downloaded the handout, you'll be able to click that. It's a live link and it'll take you there. If you're familiar with MedicaidAlaska.com, you would get to this page by going to Documentation and then Documents and Forms and then Provider Billing Manuals. Arranging Patient Travel is up here on the top row, and you can open it either by clicking the spine or by clicking the topic over here on the left. And this manual is exactly what it sounds like. It's for everybody who arranges travel for patients. It walks you through your processes. It has a discussion of what will and won't be covered in an appendix in the back. Generally, it's not down to the nitty-gritty for every single code, but it gives you some general guidelines and talks about the vouchers as well. So when you are in the manual, you can navigate around. You can either just read through it, just like any other type of e-document, by clicking the next, and on other pages there'll be previous buttons. You can just click around like that. You can go to topics that you want to read on, or you can search on a search term up at the top. There's a lot of provider manuals out on our page, and they all work pretty much the same way. So if there's other documents out there that are helpful to you, they all work like this one. All right, so that's some general information about travel authorizations. when you need them, where to find some helpful resources, and who can and who cannot request them. All right, so another common topic or question is, will travel be covered? Because, of course, if you've been screened for this before you even call in, you may well be able to save yourself some time. All right, one thing, transportation is only covered by Alaska Medicaid for members who have Medicaid coverage that includes transportation benefits. Medicaid eligibility is not all one monolithic thing. There are a number of different programs that a person can have Medicaid eligibility under, and your person needs to have one of those eligibility codes that includes this. So you can check eligibility a number of ways. You can check online through Health Enterprise. You can call in. There's a fax form. There's an automated phone line. So there's a lot of methods you can use to check. The eligibility codes that are listed here do not have coverage for transportation or accommodation. And you can see the one that would probably be most relevant is 19WD, Waiver Determination. And that's, of course, coverage just for waiver determination. And in those cases, you may have some limited transportation benefit for that. Likewise for 25DE. So this is just kind of a good list to be aware of. If any of your clients has one of these eligibility codes, just be aware they may have limited or no travel benefits. All right, also, again, travel is only covered for travel to services that are medically necessary and that are covered by Alaska Medicaid for that patient. The Arranging Member Travel Manual Appendix has some examples of covered and non-covered travel situations. And really that appendix is based on a guidance document that was put out by the state of Alaska in, I want to say, May of 2015. So it's available either in the manual or in the provider reference material page on MedicaidAlaska.com. So that can give you some guidance as to generally whether a type of service is going to be covered for travel or not. All right, so we've done some preliminaries. You know what vouchers are about. You know whether travel is likely to be covered or not. Now let's talk about the service authorization process itself. All right, the arranging provider obtains necessary service authorizations for members' non-emergent travel needs. And you would do that by calling Conduent Services Travel Prior Authorization. If you are calling our 907 number, which is 907-644-6800, you would choose option 5. Or if you're calling our 800 number, which is 800-770-5650, you would choose option 1 and then 2. The information that you want to have together to make the call go quickly and smoothly that they're going to ask you about is the member's Medicaid ID number and of course, their name, the appointment date and time, or dates and times if you're calling to set up for multiple rides, their diagnosis that they are traveling for treatment of, referring and receiving provider information, as much as you have. If you have Medicaid IDs and NPIs and that sort of thing, that's great. That's really helpful. But if you at least have the name, that's something to go with. The patient's origin and destination points, and even if it's in the same town that they're traveling within, that you do still need to kind of know that. If you are requesting an escort, the escort's name and other information. And then what specifically they need. So is it 2 taxi rides? Is it 4? What exactly are they going to need to have in place? All right, as I mentioned, we're going to talk about escorts at this point. So escorts are defined by the state of Alaska in Title 7 of the Alaska Administrative Code, Chapter 120.490, as a person who accompanies a member to and or from a source of medical care. Members can be authorized for escorts if they are children under 18 or for adults when it's medically necessary. Escorts do not need to be medically trained, but they do need to at least be 18 years of age and mentally and physically capable of assisting the member. They are not reimbursed for their time, but their travel, and in the case of long-distance travel, it would be lodging and meals as well, but mostly for what you would be organizing, it would just be local travel. So those rides are covered during the specific evaluation and treatment window. And again, if they are traveling long distance, they would need to share lodging with the members. There's more information on the Medicaid policy clarification for non-emergent out-of-area travel memorandum, and that is the memorandum I was talking about earlier that is now also the appendix in the back of the arranging member travel manual. So you don't need to refer to both of those. If you're looking at the manual, you've got that document. All right, so once you have requested a service authorization, while you're on the phone, you will generally be told whether it's approved or not. In some cases, they may need to pend if you need more information. But after the fact, you will receive confirmation of travel authorization approval or denial. They do mail out letters to requesting providers. And also you can check online. So if you have a situation where you've arranged travel and a couple days have passed and now it's time to write out the vouchers, you can log into MedicaidAlaska.com and check what's been approved. So you would do that by following the instructions here. So log into MedicaidAlaska.com, click on or hover over the Authorizations tab, click on View Edit Authorization Request. You will come to this screen. If you have the service authorization number, you can just type that in. Otherwise, you can type in all the other relevant information. Click Search, and you'll see what was authorized. All right, so once the authorization is in place, you've called in, you've made the request, it's been approved, there are still some things that need to be done. First are completing the voucher. Authorized travel is documented on the AK-04, which is also known as the travel voucher, transportation authorization and invoice form. Please be aware, and this I'm kind of leaning on because this is another thing that's been a common cause of misinformation or common base of information. Transportation providers cannot bill if all they have are faxed, scanned, or emailed copies of vouchers. They absolutely must have an original voucher document in their hands for them to legitimately submit a bill for their services. And an original voucher can either be the top sheet in the voucher pack or any of the 3 carbon copies afterwards, but they must have one of those original pieces of paper out of the voucher pack. They may not use copies to bill Medicaid. If they do, that is fraud, and they will be in some pretty significant trouble. So please do be aware of that. The member of their escort must give the driver an original voucher for the driver to be paid for services rendered. Vouchers can be obtained by enrolled providers from Conduent. You can either email Alaska Travel Voucher at conduent.com. There's a healthcare orders form order request form that's posted out on our forms page. You can fill that out and either fax or mail it in. And we are in pretty soon, I don't believe this is launched yet, but you will soon be able to call Provider Inquiry and request those voucher forms. So that is where those come from. Requests for forms do need to include the provider's name and their Medicaid ID number, the amount that you request, and the address the form should be sent to. So some things about voucher requests. Please do request enough for what you feel like you will use for about 2 months or so. Just because it is a bit of a process, they do need to track and monitor where vouchers are going. So it's not something that can just instantly be turned around and mailed out to you right that second. So it does take a while for forms to get out, particularly if you're living in a more remote area. So do kind of have that in your mind for them getting the mail to you. Right, so once transportation authorization is approved, the arranging provider completes a voucher form for each potential provider that will be billing for services. So the number of voucher sheets you need to have completed is based on the units requested and approved. So if you're authorized for 6 taxi rides, you would need 6 sheets of voucher, each with the number 1 specified as the taxi unit. Same thing for a wheelchair van or any other type of ride. Each sheet within a packet is a voucher. So for this example, you would complete basically a packet and a half, each with 1 unit specified on them. You need to complete the entire top portion of the form with the patient's personal information, the escort's personal information if they have one authorized, and the applicable unit for that form. And we're going to look at example sections from the form in a little bit, so we'll have an example of this, but just know that's the part you need to do. Do not fill in charges. That's for the transportation accommodation provider to fill in what they're charging for their service. Do not fill in the provider information or sign at the bottom of the page because, yet again, this is for the transportation provider. So that is their billing document, essentially. Provide all original authorized AK-04 or travel voucher forms to the patient or their escort. Do not give members blank vouchers. And this is another thing that we are kind of stressing. Basically treat those voucher forms like it was a prescription pad or a blank check or any other thing like that you need to keep secure, because they're basically, that's exactly what they are, as kind of blank checks. So you do need to keep those secure. And do just make sure you're not giving people extra forms or blank forms. If there's an arranged appointment that's delayed prior to the trip, the arranging provider is going to need to amend or reestablish the travel authorization. So just be aware if there's changes, you will need to do that updating. Otherwise, the member will not be able to do their travel. All right, so as I said, we're going to look at some example sections from the voucher. So here is the top section, and those of you who have filled these in, this is going to look very familiar. So you start up here in the upper left, check the box that you have checked their eligibility, enter your initials and date, enter the patient's name, their Medicaid ID number, their date of birth, and their gender. Indicate if this is emergent or non-emergent, and by and large, for your circumstances, it's mostly going to be non-emergent. If the travel that the person or the treatment that the person is traveling for is anything to do with their employment or an accident or injury, just fill in the check the yes boxes or the appropriate type of injury. Otherwise, just say no there and leave B blank. Then right under that is the patient's address and their phone number. If this is a Well Child Services referral, check yes in box 7. Box 8 is the prior authorization number that the representative you talk to is going to give you, so you do need to document that. It needs to start with the letter P and then all the digits, and then the name of the person that you speak to who's authorizing the services, and then write your signature here, and then the date that you obtain the authorization. So as noted on the bottom of the screen here, 8 and 10 absolutely must be filled in. If those numbers are not there, the transportation provider is not getting paid for their services. Great. Then you get into the patient's origin and destination point, dates of travel, and then the unit. All right, so for the patient, fill in their origin and destination points. Origin is where they live, where they're leaving from. Destination is where they're going to. And again, for a lot of the things that you're organizing, this may very well be the same town, and that's fine. It's still, they both need to be there. Round trip, so departure and return date. You would not be using one way. One way is generally going to be for long-term travel when it's really not known when the end of that travel is going to be happening. So that really would not be for your circumstances. And then, again, you're filling in one sheet of paper for every service provider that the person is going to be dealing with. So you would just have number 1 next to ground taxi, or you would fill in the case of wheelchair van, write the service number for wheelchair van and document that, and then the number 1 for the unit, and one sheet of paper for each provider that the patient would be working with. And again, as it says, don't fill anything in the charges column. That is for the driver to complete. All right. Then next to the patient information is the escort information. If the person does not have an escort, we do ask you to please cross it out like you see here, because unfortunately, a relatively common route of fraud is people sort of inviting escorts along with them. So crossing it out like this helps avoid that. But if they do have an escort, fill in the escort's name, the dates of their trip, and then what they need. So units of taxi or whatever the case may be, or wheelchair van or whatever. All right, and that's it. So you're not filling in the charges information. You're not filling in the information in the bottom. Those of you, again, who have filled in these forms, you know there's actual dates of service and charges and signatures, and that's all for the transportation folks to fill in their information. So you don't want to put anything down there. All right, The receiving healthcare provider, if they determine that the member's travel needs to change for medical reasons, then they would be the ones doing the updating and filling in any additional vouchers. This would normally be in the circumstance of a person traveling outside their home community, but it certainly could happen in local travel. So in that instance, the receiving provider communicates with the authorizing body, which most of the time in this type of circumstance would be Conduent. They would fill in new voucher forms and then give those to the member. And as a reminder, Alaska Medicaid will not cover travel that's not medically necessary, to include weekend or extra time at any destination, or even just social trips or anything like that. That is not Medicaid's medical transportation role. All right, when you have existing travel that you need to update, you can either call in and get an update over the phone, or you can fax in these forms. And this, again, is just for existing travel. So these forms are found out on our forms page. So MedicaidAlaska.com, documentation, documents and forms, and then forms page. And it's titled Transportation Authorization Update Form. So these blue fields are form fillable. So you just type in your provider name and contact person and phone number, the recipient's Medicaid ID number, the service auth you're updating, what updates need to happen, so if it's changing a date or adding units or whatever the case may be, medical need for the change or the update, and then fax it into the fax number at the top. And the service authorization team will take those and process them, and then you can check back either online or you can call in to check and see when that's been updated. All right, members do have some responsibilities with travel as well. Members are responsible for arranging their travel based on the specific transportation service authorization provided by their referring or arranging provider. Members do need to wait for those authorizations to be in place before they make any travel arrangements. They must receive complete information regarding appointment dates, times, locations, and contact information so that they can make their arrangements appropriately. They need to travel with Alaska Medicaid enrolled transportation providers. You guys probably know, and hopefully members do as well, not every taxi provider is enrolled with Medicaid, so it does need to be somebody, and not every wheelchair van also. So not all providers are enrolled with us. They do need to make sure that whoever they're riding with is enrolled with us. They can get a list, they or you can get a list of enrolled transportation providers by calling provider inquiry. Members would call the member helpline, and the number is down here on the bottom. Also, it's all over our website as well. Or you can call provider inquiry, and either of those groups can send you a list of all the enrolled providers. The member of their escort must give an original filled-in voucher to the driver. And providers can assist in the process, but the member is ultimately going to be responsible for their own transportation and accommodation. All right, members can call the member helpline, which is 800-780-9972, and they can get guidance on travel there, but they will need to arrange their own travel, and authorizations need to happen the way we were discussing. So they're not going to be able to make any arrangements or authorizations through that helpline. All right, so additional travel information or additional information about transportation and accommodation. Care coordinators should be aware that travel authorizations obtained by medical providers may be from authorizers other than Conduent. Travel authorizations that need to be updated can only be updated by the agency that originally authorized the travel. So Conduent, and you know our information, we talked about this a bit earlier in the presentation. Also, it's posted on our Contact Us page and a number of other places on the site. YKHC, Yukon Coast Clim Health Corporation, is also authorizing and arranging travel for their patients, and their contact information is listed here. ANTHC, Travel Management Office, is also authorizing and arranging travel, and likewise for Tanana Chiefs Council. So all these agencies are arranging travel, and existing travel can only be updated by the original authorizer. So that's just something to be aware of. Members may need to travel out of their community of residence for medically related services. Medical providers would almost certainly be the ones arranging this type of travel, but care coordinators may very well need to assist their patients just in understanding what's going on or taking some of the steps they need to do their travel. In general, transportation from one community to another is not authorized if the patient can get the medical services they need in their local community within 3 months of need, and that does include services by traveling providers. If the member cannot wait for services in their community, a licensed provider does need to give documentation justifying the medical necessity for the transport and explaining either why the services can't be provided in the local community or via telemedicine, where that's appropriate within the 3 months, or why the member can't wait until the services become available within 3 months. And for this specific circumstances, licensed providers include MDs, AMPs, PAs, DMDs, psychologists, social workers, and that's social workers affiliated with a medical provider working with the patient or mental health clinician. So any of those folks can provide this justification why a person needs to travel and not wait. If a member or an escort does not travel and has unused tickets, the member does need to notify the Medicaid travel office to void the tickets. Travel authorizations and arrangements are for medical necessity purposes only. If a member uses tickets for reasons other than the intended purpose, they will be asked to reimburse Alaska Medicaid. For example, if they use tickets before they're voided after an appointment that's been canceled. And for more helpful travel tips, members can refer to the travel tips for Alaska Medicaid members or the travel tips for Alaska Medicaid escorts. And both those flyers are available on MedicaidAlaska.com on the member page, which is a good page for you to be aware of and also for you to direct your members to if that's something that they would be able to access. Another thing for everyone involved with travel to be aware of is the no-show airline policy. When a member and or their escort's travel plans change or they can't make a scheduled flight, they must call the entity that originally arranged the travel before the flight departs. And that would either be the Alaska Medicaid Travel Office if travel was arranged through Conduent, YK, YKHC, NTHC, or TCC, and those patient travel offices would also be appropriate if that's who originally arranged the travel. If a flight is not canceled prior to departure, the remainder of the itinerary will be canceled and Alaska Medicaid may not pay to rebook the missed flight. And that is due to a change in airline policy, and this has been in place since last summer. All right, and again, that's just kind of some bare bones about out-of-town travel. There's more information about that if you are interested in kind of knowing more about that, and the information about that would be in the Arranging Member Travel Handbook, as well as in the fuller presentation on this topic that's posted out on our training page. All right, so some additional resources that may be helpful for you. MedicaidAlaska.com, which I've been talking about through the presentation, and which we're going to take a minute and go look at in a moment. We'll give you a lot of the information you'll need for successful billing and for successfully requesting and filling out travel service auth. It gives you access to provider-specific billing manuals and fee schedules, as well as helpful guidance documents, remittance advice messages, contact us page, and much more. You can also call us. So the provider inquiry line is, if you're calling the 907 number, it's option 1 and then 1. Or if you're calling the 800 number, it's option 1, then 1, then 1. All right, so that is the presentation that I have for you. Oh, I'm sorry. No, it isn't. We do have some more resources here. I'm sorry, I forgot about this. And these were put together by Kara at Division of Senior Disability Services. So some other transportation and accommodation resources that are available potentially for members in some situations. In Anchorage, Anchor Rides is available. People can self-pay, and it is a $3.50 one-way trip. And the information about that is available on the Muni's website. There is some People Mover travel training that's available, also available on the Muni's website. And again, if you're accessing this presentation electronically, those are live links, so you'll be able to go and access that information. There is information on the People Movers accessibility on the Muni's website. Statewide, there are senior ride programs that you can get to through alaska211.org. For veterans, veterans rides for medical appointments in Anchorage and Fairbanks may be available through the Alaska Legion Auxiliary Organization. MATSU transportation information is available at linksprc.org. There's faith-based services available through Love Inc. in Tanana Valley and Fairbanks. Volunteers provide rides to medical appointments, and you can communicate with them at info@loveincorporatedfairbanks.org. In Anchorage, Lutheran Social Services gives free medical rides for up to a month, vouchers, and they are available at www.lssalaska.org. Various other nonprofits are available for some circumstances. So Y on Wheels for families and service members on Jaber and Eielson Air Force bases. So dollar rides for medical appointments, groceries, etc., and you can get to them through the website shown there. The American Cancer Society gives rides for people going to cancer treatments, and YWCA of Anchorage gives free breast and cervical cancer screenings, and they also offer help with paperwork, appointments, scheduling, and a taxi to and from the appointment, as well as language interpreter services. And finally, there are internet ride-sharing services, so Uber and Lyft, which are here in Alaska and which have become increasingly popular, and many of you may be familiar with these services. So these are phone apps. You can request rides for yourself or for someone else. Payment is based on the distance traveled. There does need to be a credit card attached to the app, but that may work for a family member or a legal rep who wants to pay for and request rides for a member. It is affordable and safe, and drivers are motivated to give good service. And then also Care.com has many Alaska listings for rides and assistance, although people who access these services do need to pay for the workers' time. So there's a lot of resources out there, even beyond Medicaid services and voucher services. So there's a lot of other resources that members may be able to take advantage of to get rides within their community. Okay, so at this point, I am going to take a minute and show you the website and show you where to get to some of the resources that we've been talking about. And I'm going to go to MedicaidAlaska.com. And when you're out here, you would probably come into the home page and it would look like this. So a lot of the resources that we talked about were on documentation and documents and forms. And to get to the Arranging Patient Travel Manual, you would click on Provider Billing Manuals. Click through the questionnaire. And then the manual is right here. So you can open that up like this, and it looks, and you do have to accept the terms, and then it'll look just like this. So you can just kind of scroll through and look at all the information, whatever it is you need to look at. You would probably mostly be looking at local travel. And then the appendix that I was talking about is right here. So this gives you some circumstances, whether travel would or would not generally be covered, and for adults or children. So that's one resource that you can definitely make use of. Also in Documents and Forms, the Forms page. And this is where you would find the Transportation Authorization Update form, and that is here in the Service Authorization Forms section. So you would click on this, and this would just be to update existing forms, or existing travel service authorizations, sorry. And you would just fill in your information in the fields, and then it's printed out and fax it to the number up here at the top. And then to order voucher forms, as I said, you can either fax or mail in the form that I'm going to show you, or you can email. So you would go to the healthcare form order request, and there's the mailing address, or there's the mailing address, there's the email address. Fill in the information about you and about what where these should go to. Indicate however many of the forms that you would like, and you just want to fill that out here. You can you can request a custom amount, but otherwise there's some sort of basic numbers there for you to do. And then sign, and that does need to be an original signature, and enter the date, and just submit it to us. And again, allow time for delivery. All right, so that's that. And the one last thing I wanted to show you out here is on the member page. So I talked very briefly about the UpStat travel program. So where I am is on the members page on MedicaidAlaska.com. There are resources here that we briefly mentioned in the presentation, and these are just sort of helpful tips for members and their escorts about how travel works, and who they need to communicate in what circumstances, how to handle the vouchers, numbers that they can call for any kind of, on-the-spot help. So that's a helpful tool, and you may want to have those for your members or just point them to it on the website. But the UpStat Well Child program is a sort of a parallel program to the Medicaid travel. So it kind of covers some of the same things, but then it has some differences from Medicaid medical travel. So who is eligible to receive these services is, as I mentioned, children under 21 and pregnant women who have Medicaid or Denali Kid Care eligibility. They would request transportation services by calling the number, one of the numbers given here. They can use this email address, but the staff that mans this generally says that calling is a better bet. There will be a quicker response. So those options are there, but they should not use the email address if they need a pretty quick turnaround. So one thing that's different from medical travel is for this specific program, either the members or their escort, parent or guardian, can do the requesting in addition to medical providers. They will still have to have the same information, the name of the person needing travel, escort if the person's a minor, Medicaid ID and date of travel, date of birth of the person, date of travel, where they're traveling to and from, including physical addresses, home and mailing addresses in some circumstances, and then they would just call this number to get that authorization in place. What is covered through this program is taxi rides and bus passes, which does coincide with Alaska Medicaid medical travel, but also gas reimbursement, which Medicaid does not do. The business and what they will travel for is medical and dental appointments, which again kind of overlaps with Medicaid medical travel, but they will also cover WIC appointments, which Medicaid medical travel does not. So it's a little bit different. It's handled a bit differently, but it's good, worth knowing about for your patients that are children or pregnant women. To arrange this kind of travel, it does need to be done at least one business day in advance. For most transportation requests, they are available Monday through Friday, 8 a.m. to 4 p.m. And if they're going to be requesting, if the patients are going to be requesting a bus pass by mail, they do need a little bit more of advance time for that because that does need to get mailed out. All right, so that's a sort of an alternate transportation program that may be helpful for some of your members. Member helpline is also down here on the bottom of the member page. So if your clients are not aware of this page or not familiar with it, it's a helpful tool for them, and you may want to point this out for them. All right, and that is mostly what I wanted to share with you on Alaska Medicaid website. So that is what I have for the presentation. Kara?
Yeah, thank you so much, Marilee. Yeah, I can do that. Let me grab my let me grab my screen here. Okay, so we've learned a lot about the transportation requirements to request it. Now it's time for questions. We did have one question there, and I think it was more so related to the vouchers and filling them out. I think the question was, I think the person that asked it isn't here, but it's still a good question. The question was, how many vouchers do you fill out for trips? Is it one per trip, even if it's a round trip, or one per provider?
It would be one per provider. So for most trips, it would probably be 2 voucher forms. So one ride to the appointment, one ride back.
Okay. And the question was, why is there an option for a round trip? I think it just describes the type of trip, right?
Oh, that's the date range. That's really more talking about out of town travel.
Okay.
Oftentimes when people are, and that's really mostly what those forms are kind of built around. But oftentimes people will be leaving their home community on one day, traveling out of town to Anchorage or Seattle or wherever they're going, and it may be several days until they get back to home. So that's really what that's about. It's that date range is really just for that. So for a taxi ride, the round trip dates would just be the same day.
And this is Mariah with the state. For the round trip, also, it would be marked as someone's getting picked up, going to the doctor's office, and then returning home, where a one-way trip would be marked as somebody was at the hospital and they're only returning home. So there is not going to be a round trip associated with that travel.
Good to know. Thank you. Okay, more questions coming in. Question says, we are a transportation service provider. What code would I use to bill for an Escort for A0130 wheelchair van service? I do not see a code listed for an Escort for that type on the fee schedule.
If you are a wheelchair van, Escorts are not authorized for payment purposes. Escorts can ride with the client, but they are not to be billed.
Okay. Next question says, can a person get a voucher to get test results? Recently, Conduent denied my request saying we don't cover transportation for people to get test results.
That's correct, because test results can be discussed over the phone.
Okay. Question says, pharmacy stops. I don't always know when if it will be necessary. I'm not sure. I guess maybe frame it as a question. Are pharmacy stops part of transportation under non-emergency local transportation?
Pharmacy stops would be authorized if it was requested at the time of the transportation request, or if the member goes to the provider and then the provider prescribes medication and someone calls in the pharmacy stop. Otherwise, if it's not prior approved, then a pharmacy stop would not be authorized. If it is prior approved, they would be authorized. And pharmacy stops have to accompany a doctor's appointment.
Okay. Thank you. Question about the reimbursement rate for bus transportation. Is there a set rate for bus transportation, or does the provider set its own rates? Okay, I can probably answer that one. The enrolled transportation provider has reimbursement rates that are set that are determined by Office of Rate Review. So those are set. If the provider also takes payment for rides that are not billed to Medicaid, then they can determine their own fare for rides that are private pay or outside of that. Anything to add, or did I get it?
You covered it pretty well. Medicaid doesn't use buses besides out of 2 locations. And one is the Talkeetna area and the other one is the Glen Allen area. Otherwise, like regular inner city, we don't actually use like public transportation buses, but the rates are set based on ORR and the company themselves.
Thanks. Remember, we're talking about medical transportation here, not waiver transportation. Okay, it's not a waiver. But but it all comes under Medicaid, so rate questions are pretty similar to between the two. Okay, am I correct that routine vision or dental appointments are not covered?
That is correct. That is in our regulations under non-covered services. There has to be a medical need in order for the like the vision exam to take place.
Okay. Is there any time that a conduit would want to get a plan of care from a care coordinator? Going to, for example, going to PT weekly. Is there a time when a conduit would require the waiver plan of care when it comes to requesting travel?
It's not so much the waiver plan of care, it's the actual medical plan of care that we request. And so OT, PT, speech is the stuff that we do request plans of care on. We also request plans of care for pain management.
Okay, thank you. Question says, is there only one round trip allowed per day per client?
Well, it depends on the situation. So if you have a member who, say, has a doctor's appointment at 2 different locations, we generally will allow the pickup from home to the doctor's appointment, then the doctor's appointment to the other doctor's office, and then from that doctor's office home. We generally don't allow a person to go from home to the doctor, back home, wait an hour, and then go back to a different doctor's location and then return home. We want the care basically coordinated and utilized in the best possible manner, and that would be scheduling it so that the rides are concurrent to the different locations.
Okay. Thank you for that. More questions. How and who will determine what type of vehicle the client needs? A taxi or a wheelchair van?
That is up to the provider or the care coordinator calling in. If somebody is in a wheelchair and they need the extra assistance, then it would be more appropriate for them to ask for a wheelchair van. Otherwise, anybody who's not in a wheelchair or confined to a wheelchair could utilize the taxi. So it would be however you guys request it.
Okay. Back to dental and vision. If it's not a routine visit, such as the person has an acute issue, is travel covered?
Everything's based on medical necessity. So I can't blanketly answer yes or blanketly answer no, because it depends on the individual. It depends on what the issues are, on whether or not Medicaid would authorize a trip for dental or vision.
All right. A question says that from the experience of a transportation provider, having been denied payment for transportation at times with a message that the dates of service were after the member's eligibility dates, how is the requester given a service authorization or prior authorization number showing the rides authorized if the member isn't eligible?
The provider or the care coordinator should be verifying whether or not the member has eligibility before they're contacting into Conduent to set up the transportation. Occasionally, Conduent staff also is looking for that information as well, but it's possible when someone is, say, going from February into March, if March isn't reflecting benefits, it's possible that it was unknown at the time. And if you are a transportation provider, then you should appeal the claim if you're getting denied for that reason.
Thank you. All good to know. Other questions? That was the one at the bottom of the list. You have additional questions about this type of transportation? We'll give you a little bit here to think and write. Okay, question says, is transportation covered for things such as mammograms?
They are not, unless there has been history of cancer or family history, and that is determined at the time of call.
Additional questions? That was the one at the bottom of the list once again. Thoughts, questions, anything we haven't covered? We'll give just a few more seconds here to see if any words pop up. That's one of the odd things about our webinars. Sometimes there's a little bit of silence while people are thinking, but it's just part of the webinar. Okay, well, I'm not seeing any more questions come up. So I just want to thank our presenters today. We're going to close our session. Thank you so very much for sharing this very valuable information with us. We are having a recording of this session become available on our YouTube channel, SDS Training YouTube. Give us some time to get it ready to be on the channel. It takes a little bit of time for it to upload. If you think of questions after the fact, you are welcome to email your questions to sdstraining@alaska.gov, and I'll put it in the comment box here for you. sdstraining@alaska.gov, and we'd be happy to answer them or route them to our presenters for their expertise. And that being said, we'll go ahead and close our session. So you can click